So thank you all for coming out on a Sunday afternoon to talk about itchy, scratchy stuff. And thank you also to Daniela and Jen and Jeff for having me back to Animal Community Talks. I'm delighted to be back. We always have fun when we're here. So today we are going to be talking about allergies in dogs and cats. A little bit about me. I am a small animal veterinarian. I have been in general practice for 26 years. I am not a veterinary dermatologist. I am not a specialist of any kind. But I have been seeing allergies. We say, well, how common do we see allergies in general practice? On an average day, I will see 2 to 3 allergy cases. During allergy season, that can easily go up to 5, 6, or more cases a day. So we see a lot of allergy cases in general practice. If you have an animal, itchy, scratchy animal, and that animal needs help, I'm the kind of person you see first, the general practitioner. So I get the ball rolling. So I'm approaching this from the perspective of a general practitioner, kind of that first line person, and also as the owner of an allergic dog. So I have, unfortunately, personal experience with this as well. Allergic skin diseases are not only one of the most common chronic conditions that we see, they're also among the most frustrating. Many times people feel like they're kind of caught in a loop of treatment and relapse and treatment and relapse and treatment and relapse, kind of on and on and on. It's not uncommon for us to actually have pets brought to us because nobody in the house can sleep. The pet can't sleep, the owners can't sleep, and so and then owners get the medications, they go home, and the medications work for a week or 2 or 3, and then it all starts up again. So not surprisingly, many times people feel that they're on some kind of itchy, vicious hamster wheel that just is never going to stop. So what my goals are today is to help people understand allergies a little bit better, what they are, what to look for, what the different types of allergy are, how we diagnose them, and treatment options that are available. And when I talk about treatment, actually a word that you're going to be hearing a lot today is management. Our goal is management because nobody can cure allergies. We can't cure them in people. We can't cure them in animals. The best we can do is manage them. And our overall goal is to keep that allergic animal as comfortable as possible, as symptom-free as possible for as long as we can, for as much time as we can. So that's our overall goal. For you as owners, when we're working with allergies, this requires a team effort. And it requires some work, both from us as the veterinary team and from owners as well. And so for owners, one of the things that's very, very helpful to know is what are you looking for to know whether or not there's even a problem. How do you know when it's time? What differentiates maybe normal grooming that maybe is a little bit intense from, okay, now we've crossed the line into an actual issue. So, I mean, you're not going to bring your animal to the vet every time he scratches his butt, right? So, clearly. But some signs are very, very obvious, some not so much. So that's what we're going to talk about first, is what to watch for at home to see where we start crossing the line. So first thing is unrelenting itchiness. And the key word here is unrelenting. And there's things specifically that we're looking for. If the animal's scratching starts to interfere with like their normal activities, animals shouldn't be stopping in the middle of a meal to scratch. If you bring your dog to a dog park and he has to sit down every couple of minutes and scratch, that's not normal. So, or you're out just walking on leash and your dog has to sit and scratch, every 5 or 10 minutes. That's not normal. They should be able to be getting through activities without having to stop to scratch. Are they waking up? That's a big one. As I said, that's one of the big reasons why we see these guys come in. because nobody's sleeping. So, I mean, everybody wakes up every once in a while during sleep, it's like, oh, scratch something, and you go right back to sleep. But is it happening over and over? Is this happening every night or most nights? Is it happening multiple times a night? That's not normal. Can you distract your pet from the scratching? Now, if the itch is so intense that you can't distract your pet from the scratching, that is a 4-alarm fire. That needs to be seen. So, but if you can distract your pet from the scratching, then does he then forget about the scratch and go on and do something else? Or as soon as you stop being interesting, does he go right back to scratching? Because that's not normal. Are you seeing bald spots? We get this a lot. We get this question a lot from people who are concerned about their animals shedding. And they're like, I could build a new cat with what is coming off this cat. And so we have 2 questions. First, is your animal doing any of these things that we just talked about? And second, are you seeing bald spots? If the animal is not excessively itchy and there's hair everywhere, let them shed. Some animals have a heavier shed year than others. That's totally fine. Bald spots, not normal. So if any of these are happening, this is the ideal time where we want to see these pets, if possible, when we're at this stage, before they start developing secondary problems, like infections. If we catch them here, then we can usually get things under control pretty quickly, start working on whatever the underlying problem is, and we can usually do that with a lot less medication. That said, most of the time, we're seeing animals come in because they have now secondary issues that are becoming more obvious. So this is usually when we're seeing them. And the key for all these secondary issues is redness. So red skin. Red skin can be generalized. I didn't have room on the slide to put the whole dog on, but you can see he is red from his chin all the way to his tail. He's just everywhere. This is very localized. We all know what this is. This is a hot spot. A hot spot, or acute moist dermatitis, if you want to use the technical term, is a very localized area of severe inflammation and moderate to severe infection. The rest of the coat may be fine, but we have a big problem right there. We're often seeing hair loss. You may see a rash. So this is on a dog's belly, and this is a kind of classic presentation for a secondary staph infection. This is a cat's head. You can see ear right here, and there's his eye. This is the temple area. We've got scabs and crusting. We may see excessive scaling somewhere along the coat as well. Bad odor. Skin should not feel greasy. You can have, your dog may need a bath. He may have rolled in everything under the sun for the last 3 weeks, and you haven't had a chance to get him into the bathtub. So he may feel kind of grody, but he shouldn't leave your hands feeling like you have to wash them in Dawn soap to get the grease off. You shouldn't feel greasy. And if skin issues are going on long enough and they become chronic, we get this darkening or thickening of the skin. And that will happen anywhere on the body that we have chronic inflammation. I'm sorry, my type is kind of ginning up on each other. This was developed on a Mac. It's being shown on a Windows, and sometimes they just don't. They don't like each other. But any or all of these are potential signs of skin infection. So we want to see this, because skin infection is going to need treatment. This is not going to clear up on its own. Cats, being the special creatures that they are, have a couple of unique types of lesions that they will sometimes pull out of their kitty bag of tricks. The first of these is miliary dermatitis. And many times you don't see this, but you'll feel it. You put your hand down to pet your cat, and you feel small, hard bumps. Most commonly seen down the back, but we can get them on the throat. We can get them on the head. They can really be anywhere. Those are the most common areas. There may be just a few scattered in one area, or they can cover almost the whole cat. They are generally intensely itchy. And the spots themselves, if you touch them, they're sensitive or painful to touch, which you will find out if you mess with them too much. Your cat will let you know. The other thing that cats can do is something called eosinophilic granuloma complex. And this is a swollen lower lip. So there's this little fang right there. His nose is up here. And he's got a big fat lip. He looks like someone punched him right in the face. So these can show up like this, like swollen lips, ulcers on the lips, red plaques on the skin, red welts down the back of the thighs. Sometimes they're itchy. Many times they're not. Sometimes they're painful. Sometimes they're not. So miliary dermatitis and eosinophilic granuloma complex can be caused both by an allergic reaction or non-allergy causes. When they're caused by allergy, they can be caused by any allergy. So they're just kind of the general, non-specific signs that cats will sometimes show. And not all cats get these, but these are unique to them. Red ears. Could be one ear, could be both ears, could be alternating ears, depending on the phase of the moon, sometimes it seems like. You'd think if things are being caused by allergy, it would hit both sides. Doesn't always. I have no explanation for that. So what we're looking at, you can see in, go back. Someone's holding up the ear flap in this dog. His face is over here. And so not only is the opening to the ear canal red, but pretty much the whole ear flap, inside ear flap is red. Redness alone is abnormal. But you may see discharge. You may smell an odor. You can always tell when people have experience with ear infections because they'll take that dog's ear and they'll just pull up the ear and they're just smelling down in there, see what it smells like. So many times you'll get an odor. Holding the head down or tilting the head, they will hold the head down to the affected side. If both ears are affected, they may not tilt the head or they're going to tilt toward the side that's worse. Sensitivity when the ear is being handled. Not all dogs do that. Most of them do. They'll be pawing at the ear, scratching at the ear. They'll be sensitive when the ear is handled. Every once in a while, I'll have a dog in just for a regular, or a cat in for a regular annual exam. We say, how's everything going? Oh, everything's fine. No problems. No, everything's great. We're just here for the rabies shot. I get my otoscope and doing my exam, and I look in one ear, it looks great. I look in the other ear, and it's a swamp. It's like fire engine red. There's pus in there. And I was like, he has not done anything. Usually it's a golden retriever, and he's just like, my ear hurts. So sometimes they're not sensitive. Most of the time they are. And again, if ears are skin, so if it's going on for a while, we will get this kind of thickening and darkening of the skin up in here, and you can see how thickened that is around the ear canal. And that can extend all the way down the ear canal. Many times people with dogs with red ears, by the time we see them, they say, well, I thought it was ear mites, so I treated with ear mite medication. If you have a kitten, absolutely it could be ear mites. If you've got an adult cat that's indoors, no. It's not even that common in adult cats that are indoor-outdoor. We don't see it that commonly. And adult dogs, it is uncommon to the point of rare to have ear mites. Foreign bodies, dogs are the champs at foreign bodies. Getting foxtails in their ears, absolutely. So those are all things that we check for. And even adult dogs, we still check for ear mites just in case. But by far the most common cause of red ears is going to be ear infections triggered by allergies. And how does that work? The infections themselves are either bacterial or yeast or both. And bacteria and yeast live in the ear normally. They're supposed to be there. The ear is not sterile. So there's a normal population of bacteria and yeast that live in there. And they're normally in very, very small numbers. Some allergies, and we'll go over which ones, can actually target the ears specifically. And they cause inflammation in the ear canals. So the ear canals become inflamed. Well, inflammation is heat, right? So inflamed skin gets warm, an inflamed ear canal gets warm, but the ear canal is this tube that's fairly narrow, and when it gets warm, it gets humid, and the bacteria and yeast that normally are living in a dry, relatively cool environment, now all of a sudden it's like hot tub party. Let's break out the Mai Tais. And the population just explodes. So, and we can see overgrowth in either one or both of those types of organisms, bacteria or yeast. Red eyes. If an animal has a red eye, we need to see it. You may or may not see discharge. Whether or not you're seeing discharge, we need to see an inflamed eye. If someone calls our clinic and says, my dog's eye is red, my cat's eye is red, we want that eye in to see us that day. And the reason is because eyes have very few ways of showing they're unhappy. They turn red, especially at the beginning of many, many eye diseases. They just turn red. And we can't tell if a red eye is red from allergic conjunctivitis. And some allergies will cause an allergic conjunctivitis, which is just an inflammation of the inside of the eyelids. Or is this a scratch on the cornea? Could this be early glaucoma? Could this be a foxtail caught underneath the third eyelid? We don't know, because it's all going to look the same until we actually look at that eye and start doing some specific tests and looking and seeing what the problem might be. So it could just be allergic conjunctivitis, and then we're going to say, woohoo, there's no foxtail, there's no scratch, there's no glaucoma, here's the tube of ointment, twice a day for a week, you're going to be fine. And we do the happy dance, because you don't want any of those other things. And eyes can get bad very, very quickly. So again, red eye needs to be seen. There's just no two ways about that. So those are some of the warning signs, some of the things that say, okay, we have now, we're now having a problem. This is an issue. We need to go see the doctor. And so we have an itchy red animal in our room, in our exam room. And what happens at that point? So we're going to start talking about management. And the first thing I want to talk about, I want to spend a few minutes talking about short-term management. Because no matter what the underlying allergy is, most of these animals are going to be treated in similar ways first, at the very beginning. And there's a couple of reasons for that. We often call, I picked this term up from a dermatologist, but we hear it all the time, and I use this term as well. Short-term management we call putting out the fire. Because again, many of these animals that are coming in already have active infections. They already have active inflammation. And we need to get that put out. This animal, this dog, who's laying on his side there, and we're seeing his chest and the groin area, this is just fire engine red. And he's got secondary infections here. And we need to get that under control. If we don't get that under control, then nothing we do for the allergy is going to work. So we can't have effective treatment of any underlying allergy until we get active infections under control. Also, skin and ear infections are incredibly uncomfortable for the animal. Skin infections in particular are extremely itchy. So a dog like this, if this is the first time I'm seeing him, and he's really itchy, I have no idea how much of that itch is from the skin infection and how much is from an actual allergy. And we're not going to know that until we get that infection cleared up. Sometimes we get the infection cleared up and the itch will drop by 75, 80%. So we need to get the animal some relief. And also, these infections are damaging. Skin infections actually damage the skin, and they can make the allergy worse because now the skin is damaged and all the barrier defenses can no longer work. Ear infections can cause permanent damage if we don't get those under control. So short-term management to put out the fires is the first thing we're usually going to do. So what's in our toolbox? Well, for skin infections, we're often doing a skin cytology. And if it looks, if I take a look and it's a classic textbook staph infection, I'm going to treat for a staph infection. But if it's not clear from physical exam, then we may be doing something called a skin cytology. We take a swab or a little bit of scrape, and we look under the microscope. And what we're looking for, is it bacteria or is it yeast? Because those take two completely different kinds of medications. If I've got a yeast infection and I mistakenly prescribe antibiotics, nothing's going to happen to that yeast. I need an antifungal on board. We may or may not need orals. Sometimes we can get by with topical therapy. If we can get by with topical therapy, I prefer to do that. So, and topical therapy could be medicated shampoos, sprays, wipes, anything like that. Ear infections, basically the same. Many times if there's discharge, we're going to do an ear cytology, and we're going to try and differentiate again between bacteria and yeast. The top here is yeast. So we're looking through the microscope at a ear cytology slide, and these big oval purple things are Malassezia yeast. And normally, from a normal ear, if I swab a normal ear and look at it under the scope, I might find one, maybe two on an entire slide. So this is a big overgrowth of yeast. This one is just a swamp of bacteria. All that purple, all those little purple dots, that's all bacteria. And again, from a normal ear, we might find one bacteria, two bacteria on a slide. This is just, and there's actually inflammatory cells that have moved in. This is, I can guarantee if I looked in that ear, that'd be pus looking in there. So do we have bacteria? Do we have yeast? Do we have both? And then we pick a topical ear medication that is appropriate. We're also looking in that ear, again, make sure there's no foreign bodies in there, no foxtails, no growths. Those are more common in cats than dogs. They can get polyps in their ear. Make sure the eardrum's okay. Because if the eardrum is ruptured, then there's a lot of medications I cannot put in that ear because it could potentially damage the inner ear. So this is why a lot of times if people call and they say, maybe they got some ear medication like last April and it's now, the following March and they call for a refill on the ear meds, most of the time we're saying no because we have to look in that ear and see if the eardrum's okay. So that's why we're kind of mean sometimes. We want to actually take a look in that ear. The other thing we need to do, so we're clearing up infections, we're also trying to stop the itch. We've got to get this animal some relief. So we've got to get them comfortable so they can think about something else besides their skin. And if we don't stop that self-trauma, I don't care how many medications I throw at that skin, if I don't stop the onslaught from the teeth and the nails, that skin is never going to heal. Those infections are not going to heal. That skin is not going to restore itself, and we're just going to be chasing our own tail, so to speak. So in our itch control toolbox, again, getting the infections resolved can take a lot of that itch down. And if the itch is fairly mild, sometimes just getting the infections resolved is enough. Most of the time, by the time the animal is coming in to see me, most of the time, I've got to give them something else. I need to get something fast because resolving infections is going to take at least a week before the itch will start to come down, just from antibiotic or antifungal therapy usually. And if that animal is ripping himself apart, we need something fast. And that's where we are most often reaching for cortisone. Most of us, when we're using cortisone, we're using low doses, short duration. We're just trying to put the fire out. We're using it as little as we can to get away with. And so that animal may be on for 5 days, 7 days. It's rare that I have them on for more than 10 days. So it's a very short period of time. Antihistamines at this point are not going to do anything. We'll talk about antihistamines later, but in a fire situation, they are not going to do anything. So we need kind of a big gun usually at this point. But I cannot emphasize enough that short-term management is short-term only. This is just to put the fire out. It does nothing to address an underlying allergy. It does nothing to address the primary disease. So if this is all we do, it's going to come back. It could come back next month. It could come back in 3 months. It might come back next spring, but it's going to come back. So what does that mean for you? If you're the person in that exam room with your itchy, scratchy pet, is that if you're not hearing anything about long-term management, that's your cue to say, is anything we're doing today going to address an underlying issue? Could this be an allergy? And is anything we're doing going to keep, I understand it's going to clear things up now, but is it going to keep things from coming back? And your veterinarian may say, well, yeah, it could be an allergy, or I think it is an allergy, or allergies on the list. But I don't know which allergy. That's totally fair. Especially the first time we see these animals come in, especially if they're in a wildfire with infections. As we'll go through later, a lot of these presentations look exactly alike, no matter what the underlying allergy is. So we don't know on that first visit most of the time what allergy we're dealing with. We can get clues from the history, and we'll talk about specifics of that, but we don't know for sure. And that's okay, but there should be a plan. At that point, it's like, what's the plan, Stan? We need to know, what are we going to do to figure it out? And what are we going to do long-term to keep this from coming back? Because that's our goal. If our goal is to keep this animal as comfortable and as symptom-free for as much as possible, we need long-term management, starting with figuring out what's going on. So we're going to start talking about the most common allergy in dogs and cats, which is flea allergy. So again, flea allergy is the most common allergy we see in dogs and cats. And many of you may already know this, but in case not, it's really, really important to know that the actual allergy is to the saliva of the flea. The reason that that is important to know is because the severity of the itch does not correlate in any way with the number of fleas on the animal. It is only correlated with how sensitized that animal is to flea saliva. And when we bring up the possibility of flea allergies in the exam room, I can tell you from decades of experience, more often than not, we get a lot of pushback from the clients. They're like, well, my other animals aren't scratching, so it can't be fleas. This animal, I have never seen a flea on her. I always get bitten, and I'm not getting bitten, so it can't be fleas. Now, all those things are true. The other animals are not scratching. You've never seen a flea on her, and I'm sensitive to fleas, so I get bitten a lot, especially in my line of work. But fleas will only bite people if there's not enough animal to go around. So if there's only a few fleas, they're going to stick on the dog. They're not desperate enough to bite the people. So the only thing that correlates with the itch is how sensitized that animal is to the saliva. So the animal does not have to be crawling with fleas to be itchy. If they're sensitive enough, and many of them are, just a few bites will start that whole allergy cascade with all the itching and the scratching and the chewing. So that's really, really important to understand about flea allergies. That's one of the key things about flea allergies. Age of onset, these animals are usually pretty young when it starts. That said, it can start at any age. If I have a 12-year-old in my exam room and it's looking like flea allergy and it's talking like flea allergy and it's singing like flea allergy, I'm not going to say, well, you're 12, it can't be flea allergy. It's flea allergy. So what do these animals look like? This is a bulldog. We're looking at him from above. Before what I think of as the modern era of flea control, before 1997, when Advantage came on the market, we saw these every day. Every single day that I was in practice during flea season, we saw animals like this. Yes?
What is flea season?
Oh, flea season, usually the warmer months of the year. So in this area, it's generally considered to be March through November. Most of my clients think it's June through August. But once it starts getting warmer in the spring, the fleas start reproducing, and they'll go strong until the first hard frost. And the last few winters that have been really mild, we have seen fleas all year round. So I am now advocating year-round flea control, especially for allergic animals. So with dogs, the classic presentation, it starts right here at the top of the tail. It may stay there, but if the animal is very, very sensitized, it will start to spread forward. It will spread down the backs of the legs, down the insides of the legs, can spread up the entire belly. Tends to leave the front half of the animal alone. We don't usually see ear problems with flea allergies. It's possible, but not common. And usually they're like normal, and then, oh my God, from the middle of the back on back. Or it could just be a little bit of scurfiness right here. So this dog clearly is very, very affected. And this is all secondary skin infection right here. Cats can look similar to dogs, but there are special kitty things. They can do something called fur mowing. And I have a picture of it later on, where the fur is just gone. And they just have bald spots. They're not actually bald. If you look very closely, the hair is still there. It's just broken off very, very short. The hair's not falling out. It's just being broken off by grooming. But they'll have, usually symmetrical. It can be on the flanks. It can be on the belly. And they're just grooming their own hair off. But the skin looks perfectly quiet. It's not red. It's not inflamed. There's no infection. It's just the fur's gone. They can also have miliary dermatitis. As we mentioned before, this cat, it's not a great picture, but you can see this is a cat that's affected all the way down the back. And they can present with eosinophilic granuloma syndrome. They can do any of those. So how we diagnose this? First of all, history. If I have an animal coming in on excellent flea control that is being consistently given, and I'm not finding any evidence of fleas, and it doesn't look like flea allergy, then the itch is probably not fleas. But if they're coming in and there's either no flea control at all, or the flea control is really inconsistent, or the owner is using something that I know to be unreliable, and we'll talk about that a little bit more later, then flea allergy is definitely on the list. We go by clinical signs, of course. Location of the itch. Now this dog, you could see this dog across the room at a crowded party, and you'd be like, hello, flea allergies, right? That is a textbook flea allergy dog. But sometimes the itch is not in the textbook locations. Sometimes there's no lesions. If there's no lesions, but the animal's just really itchy, I'll go back up over the tail head in a dog, and I'll just be like, and if he goes, oh, they're like, huh, okay. It's not diagnostic, but it's a clue. And then, of course, we look for evidence of fleas. We break out the trusty flea comb, and we start combing. So, and this you can do at home. Flea combs are cheap. Get them for a couple bucks. Comb your pets. What we're looking for, of course, if we find live fleas, that's pretty good evidence. Happens a lot less than you'd think. We're also looking, go back. We're also looking for flea dirt, which I'm sure most, if not all of you, are very familiar with, is that black pepper stuff. And if you're like, well, I'm not sure if that's dirt or not because he was just rolling out in the cedar chips or the new mulch, then you get that stuff, you knock it off your flea comb onto a damp paper towel, you rub. This isn't a great slide, but I hope you can see the red smudges here. And if that black stuff, you're starting to see a red smudge, you have just diagnosed flea poop. Congratulations. All right. But again, remember that the severity of the allergy does not correlate with the number of fleas on the pet. And we can have a very severely allergic animal, and we're combing, and we're not finding anything. There's no flea dirt. There's no live fleas. Does that mean that it's not a flea allergy? No. Flea allergy is still on the list. Oh, to make it even more interesting, cats, special creatures that they are really, really, really good at grooming off their own fleas. So that makes it a little harder to find fleas, too, when your patient has swallowed 3/4 of them. I should add tapeworms as supportive evidence of fleas as well. A lot of times we go by response to treatment. If we suspect flea allergies, then we get these animals on excellent, consistent flea control, and we watch to see what happens. And if their symptoms clear up, yay, we do the happy dance because we've got a flea allergy. We can do something about a flea allergy. We can keep them on flea control. So if we get no response or only a partial response, a couple things may be going on. Number one, the itching is not due to fleas. There's something else going on. There's another allergy. Or if we get a partial response, the animal is allergic to fleas and has another allergy too. Yay! Which is really common. It is more common for animals to have multiple allergies than it is for them to have just one allergy. Just to make our lives more fun. All right. So we talk about excellent, consistent flea control, and you're going to hear that phrase several times more in this lecture. What is excellent flea control? Excellent flea control, it not only kills the flea, all flea products will kill the adult flea. That's not hard to do. But an excellent flea control product stops the flea from completing its life cycle. So, and that can happen in a number of different ways. It either kills the adult flea fast enough that the female fleas do not have a chance to lay eggs. And what that means is that that female has to die within 24 hours of jumping on the pet. Because they take a blood meal after about 24 hours of being on the pet after they jump on, and after the first blood meal, they lay eggs. So if we can kill them in the first 24 hours, they won't lay eggs, and we've broken the life cycle. Many products also have insect growth regulator that any eggs that are there will not hatch, and any eggs that manage to hatch, the larva cannot finish their maturation cycle. We like insect growth regulators. They're really nice, and they're exceptionally safe. So how long? Minimum 3 months to break the life cycle. The other thing to know about fleas is that adult fleas jump on the pet and they spend the rest of their adult life on that pet. They do not jump off. They live and die the rest of their life on that pet. The females lay eggs and the eggs fall off into the environment. For every flea on the pet, there is 50 to 100 immature stages in the environment. So eggs, larvae, pupa in the environment. I could do a whole talk on just flea control. There are so many options out there, and really, really good options. Topicals, orals. I spent the first several years of my career with none of these things available, and to me, this is like living in Hallelujah land. Yay! Because we used to not be able to control fleas well at all, and now we can. So this is fabulous. I can tell you what I don't recommend. I don't recommend anything where the main ingredient is fipronil, and that's Frontline and some generic brands. It still works great for ticks, but there is documented resistance to fleas. And where I worked at North Portland Animal Hospital, we stopped carrying Frontline, I think like 3 years ago, maybe 4 years ago now, because there were too many treatment failures. And then shortly after that, there are people who just look at flea resistance. They're like, yep, there is now documented resistance to fleas with fipronil, with Frontline. So it was a great product for many years, but no more for fleas. So I do have a few clients who are still using it, and their pets don't have fleas, and they're doing fine. So those fleas apparently didn't get the memo. But in general, we are now staying away from it. All the older chemicals, the permethrins, pyrethrins, carbaryl, just don't even. Many of those have now been repackaged to look like Advantage, like the spot-ons or the topicals. But they're very good at killing the adult fleas. But I've been working in veterinary hospitals since I was 16. So I have many years' experience with these. They are toxic. They don't work. They can kill the adults, but they don't break the life cycle. And this was back in the day when we were using these, was when every day we would see dogs like that bulldog come in. And these were people who were bombing their house every day, or not every day, oh God, every month. This used to be the recommendations. Bomb your house. Remember those flea bombs? Bomb your house every month. Bathe and dip your dog every week. Sprays, powders, collars, the whole 9 yards, and still every day we were seeing dogs like that bulldog, even when owners were doing all that. So this stuff, just don't. I know it's cheap, but it's cheap for a reason. It doesn't work. So much, much better to use a very, very good flea control product, and many of which are over the counter now. Advantage, which is now Advantage 2 because it has an insect growth regulator in it, is available over the counter. It's available at pet stores. I tell you, I love Advantage. Love Advantage. There's many, many products, and I still love Advantage. Don't take my Advantage away. All right. So short-term management, if we need it, absolutely. And again, that's going to be clearing up any infections that we've got going on, because secondary skin infections are very, very common with these. And sometimes, if I can get away without using cortisone, I do. Because the animal will be itchy for a little while after we put the flea medication on, because the bug bites have to heal, and that sensitivity has to go down. But if they're not ripping themselves apart, if the itching, I talk to the owner, and if the itching is just more moderate to mild, I prefer to just let the body heal itself and avoid cortisone if I can, but I will use it if I have to. If the owner's like, no, he's keeping us up all night, this dog, or that's just a wildfire going on in that skin, we may need short course of cortisone just to give the animal some relief in that short term. Okay. So, Atopy. What is Atopy? Also known as environmental allergies, seasonal allergies, grass allergies. Many times you'll still hear it called inhaled allergies, which is a little bit inaccurate, and we'll talk about why in a little bit. But you'll often hear it called that as well. And what are these animals allergic to? All the same stuff we are. For people with seasonal allergies, it's all the same stuff. Pollens, actually not to flowers. That's actually pretty uncommon to be allergic to flowers, but to weeds, to trees, to grasses. Those are the main pollen generators that the animals are allergic to. Mold spores, dust mites. Again, if people with seasonal allergies can get allergic to it, animals can get allergic to it. Incidence affects estimated 5 to 15% of dogs and cats. In some areas of the country, it can actually be more common than flea allergy. So this is an extremely common allergy. We see this all the time. We see this every day. These animals are usually young at the age of onset. So classic is going to be an animal under 3 years of age. But again, we've diagnosed it in animals that are 10, 11, 12 that have never had a history of it before. It's certainly possible. Now, you notice we didn't talk about typical breeds with flea allergy because there are no breed predispositions to flea allergy. There certainly is to atopy. Atopy is inherited. So that is not a comprehensive list of breeds. That's just some of the more common ones that are affected. Poor labs, poor Goldens. They just get it rough. Pugs, boxers, bulldogs, Dalmatians, most of the terriers, the terrier breeds are affected. Westies are the notoriously worst, but any of the terrier breeds, including the pit bull terriers, and many of the spaniel breeds are affected as well. But any breed or breed mix can have this. My German Shepherd has atopy. And a study in golden retrievers estimated that for animals that are affected, it's influenced about 50% by their genes and about 50% by environment. So what do they look like? This allergy in dogs tends to target the face. And we may not have animals coming in with the obvious redness like this, but I'll often ask owners, like, well, where is he itching exactly? Does he rub his face? Does he get up around the couch and rub his face or down in the grass? Does he like you to rub his muzzle? Because facial itchiness can be a clue. Feet and ears. Atopy targets feet, especially the front feet. It can get all four, but it really likes the front feet. So we see a lot of redness. This animal's been chewing. And this is one of those things that's like, well, all dogs groom their feet, right? But I'll ask people, can he leave his feet alone? Or does he keep going back and back and back and back? He shouldn't be working it. Cleaning is fine, grooming is fine, but working it to the point of this is, no, I keep hitting the wrong button. Ears. So atopy is one of those allergies that specifically targets ears. And then underneath, armpits are a favorite area for atopy, the groin, and sometimes it'll hit the whole belly. Now, important to know, it can be any one of these locations or all of them. I have animals with atopy that just have ear infections, or it's just their feet, or it's the whole shebang. They get it all. Cats tends to be face, neck, and ears. But again, it can also present as fur mowing. So this is that picture of fur mowing that I promised you. And you can see, and this cat, I would bet any amount of money, is absolutely symmetrical on the other side. And it's just a bald spot. And if you look closely, the hair is still there. It's just broken very, very short. So this is a classic overgrooming or fur mowing lesion. Again, miliary dermatitis and eosinophilic granuloma. So, key thing about atopy, there is no diagnostic test for atopy. It is what is called a clinical diagnosis. We diagnose it off history, clinical signs, the type of patient we're seeing. Can we find any other cause for the itching? And response to therapy. So age and breed, we already talked about. History, the key thing here is seasonality. Seasonal allergies are seasonal. So especially when it starts, when the animal is young, as again, usually starts in young animals. When it starts, what the owner will notice is that it's usually during the warmer months of the year. I have diagnosed 2 atopic dogs over my career that were only allergic to Christmas trees. Those are actually fairly easy to figure out. But usually it's the warmer months of the year. And so if this animal is 18 months and it's the first time we're seeing him for itching, we don't have a history of seasonality, but I tell the owners, I educate the owners to watch for it. Watch for seasonality, because that'll give us a clue as time goes on. But say this animal comes in for itching, I'll say, okay, so it's April. Has he done this before? Well, yeah. Actually, he did this last year, but it's worse this year. Classic. Was he okay over the winter? Yeah, he was fine over the winter. Gold. Okay, that's a big clue. Many times people will notice it flares and subsides and flares and subsides, and finally in late fall it goes away. And they're like, oh, that's done. And then next spring, here it comes again. The tricky thing is that it tends to get worse every year, and about 80% of animals with atopy will get to the point where it becomes year-round. At that point, they're allergic to so many things, including mold in the winter, that they just go year-round. And then it gets a little bit tougher. Again, we go by clinical signs. So here's, this dog just he needs his face itched. But this is not diagnostic by itself. There's some overlap with the clinical signs with flea allergy, and atopic dermatitis is clinically indistinguishable from food allergy dermatitis. So there are certain things that may push us one way or the other. It's more likely to have foot involvement in atopy than food allergy. You're more likely with food allergy to have rear end involvement than vice versa. But none of those is set in stone. And animals like to just confound us just for the heck of it. So we can't tell from clinical signs exactly what we're dealing with. And again, cats, just because they're cats, if they're coming in with miliary dermatitis or an eosinophilic granuloma, then okay, they can do that from any allergy. So that there's no clues there. So the other diagnostic criteria is there any other source of itching found? Is there any other cause found? So how much actual diagnostic work we do depends on the presentation. So for example, if I have on one fine July day, I have this 3-year-old Westie come in. He's already on excellent and consistent flea control with a reliable product the owner is applying consistently. I'm still going to comb him for fleas because I want to know if that product's working. No sign of fleas whatsoever. And the owner tells me, yeah, he's been itchy since April, and it's his face and it's his feet that seem to be targeted. And he was fine over the winter, but yeah, we remember him doing this last spring. Okay, if I've had my coffee that morning, then I'm probably going to give a presumptive diagnosis of atopy that day, especially if all the lesions and everything is adding up to that and I'm not finding anything weird on physical exam. Versus after the Westie comes in a 9-year-old lab cross, not on flea control, the owner says has been scratching pretty consistently for the last 8 months since they adopted this dog from a rescue organization or the Humane Society. And we have no history. There's no medical records that came with that pet, so we have no idea what that animal's early history was. And he's 9. So this could be atopy that's now gone year-round. This could be food allergy. This dog is in the age range for low thyroid, which causes skin infections and ear infections that are itchy. This could be mange. This could be any number of things. So this dog is going to take some workup to figure out what's going on. Response to therapy. If this animal already is on excellent, consistent flea control, or I put that animal on good flea control and there's no response, then that pretty much rules out flea allergy. And if we're doing our short-term management and we have to put this animal on a little bit of cortisone and the itch just stops in its tracks, that's a clue. Atopy, in the vast majority of cases, is extremely responsive to cortisone. There's a few cases that aren't, but most of the time they are. And you might be saying, but wait, I've heard about skin testing, I've heard about blood testing, I've read online about testing the saliva and testing the hair, but I just told you that Atopy, that there's no diagnostic test. I swear I'm not lying. Skin testing and blood testing are used. Skin testing is usually done by a dermatologist, and what is done there, this is on a patient, so generally they're going to have their side shaved, usually done under a little bit of sedation. It's essentially the same procedure that's done in people, except we don't get shaved. And at each of the little felt tip markers, they're going to get a little tiny injection of an allergen. And this animal is responding to these allergens. These, there's no response. So he's not allergic here, but he's allergic to these. Blood testing, looking for antibodies to allergens. So that can be done as well. Skin testing, again, is usually done by a dermatologist. Blood testing, many dermatologists will do as well, can also be done by general practitioners if they use that. So this may be used as an adjunct diagnostic tool, especially if it's not clear which allergy the animal has. If they are flaring like this, then okay, that's supportive evidence for Atopy, but this in and of itself is not diagnostic. The reason is because there are animals with Atopy that will not. They'll have negatives on skin and blood testing, and animals that don't have Atopy that will flare and have positive blood results. So they're not reliable enough to be actual diagnostic tests. Most often these tests are used when Atopy has already been diagnosed and the owner is pursuing a course of immunotherapy, also called hyposensitization. We'll talk about that later. And the dermatologist or the general practitioner veterinarian is figuring out which allergens the animal needs to be desensitized to. We'll talk about that process a little bit more later. And then as far as saliva or hair testing, I have had clients who have done this. So I looked into it to see, because I'm like, wow, that's cool. And there is no validity to this whatsoever. So as a matter of fact, a board-certified dermatologist a few years ago contacted one of the main companies that does this and said, can you tell us about your methodology, about your test, and show us, data? Because I'm really curious about this. Because, if this is something we can add to our toolbox, yay. If I, maybe I'll, would I consider sending you stuff, if this works, if this is valid? They said, no, it's all proprietary information. They wouldn't tell her anything. So she's like, okay. So she took saliva and hair samples from a patient that was a known Atopy patient. Took saliva and hair samples from a dog that she knew did not have Atopy, had no allergic skin disease at all. And then sent in tap water and fake fur. Got back pages of results for all of it. And then she did it again with the same samples. And got back pages of results that were different from the originals, significantly different from the originals. And she published that. She's like, just FYI. So some of these companies even claim to be able to diagnose food allergies through this. This is not, please, don't waste your money. So when I looked into it for the client who did this, and she showed me the report, it was like 3-4 pages long, all these things. And so I looked into it, and I reported back to her, and she's like, well, at least I got a Groupon for it. Okay, how do we treat it? Once we have the diagnosis, or we're pretty sure that this is what it is, how do we treat it? Because part of this also is response to treatment, right? Short-term management, if we need to. So if this guy comes in, this is massive inflammation and massive skin infection. We need to get this put under control. We need to get this cleared up. Nothing I do for Atopy is going to stand a chance if there's any infection going on. So we need to get this resolved. And then we start long-term management. And For Atopy, this requires what we call a multimodal approach. There is no one single medication, there is no one single protocol that will work for all Atopy patients. That's just how it is. Even the best stuff that we have will not work for everybody. Not even cortisone works for all of them. It'll work for most of them, but not all of them, as I learned the hard way myself in practice. So it's very, very common to have some trial and error going on until we figure out what the best strategy is going to be for this particular animal. And I warn people about that up front, because this is where things can get really frustrating sometimes, because we're trying to get this animal better, we're trying to get this animal comfortable, and we may be needing to do some things that are not going to work, but we don't know they're not going to work until we try them. So we start with things that most patients will benefit from, and then we move into specifics. So first thing is excellent and consistent flea control. We know that 70% of animals with Atopy are also allergic to fleas. 70%. So even if they're not presenting with signs of flea allergy, even if I'm not finding any fleas on them, if they are not on flea control, I want them on flea control, because I've got a 70% chance that this animal has a flea allergy. And whatever I do for Atopy is not going to work if that animal is itching from fleas. As one dermatologist explained it to me, he's like, when it comes to itch, physiologically, when it comes to itch, 1 + 1, if you've got flea allergy and Atopy, 1 + 1 does not equal 2, it equals 4. So if we can remove a known or very likely source of itch to that animal, it makes the Atopy much, much easier to manage. So all these animals need to go on excellent, consistent flea control. And if I could tell my clients one thing, that we can do at home, get your animal on flea control. Really good flea control. They all should be on it, but especially if they're itchy. Reducing allergen exposure. All atopic patients should have one or more of these management things instituted, depending on what the owner can do at home. Because you all have lives, right? So we try and work with that as well. It's like, oh, you mean you have a job? You have to leave your pet for 10 hours a day? What? So we need to work with what works for that schedule and that family. But we know for Atopy, again, this used to be called, many people still call it inhaled allergies, but we know that the major route of exposure is actually absorbing the allergens through the skin. Normal skin will not allow allergens to be absorbed, but animals with Atopy have damaged what we call barrier defenses. Their barrier defenses are damaged, and whether the defenses are damaged from the allergy and the inflammation, or whether they're born with defective skin, that we don't know yet. It's kind of a chicken or the egg thing. But we know that animals that have clinical signs of Atopy, their barrier defenses are damaged. They are absorbing allergens through their skin. So if we can reduce that, then we reduce the allergen load that they're having to deal with. So how we do this? Bathing is fabulous if we're using something that's not drying out the coat too much. If we're worried about drying out the coat too much, just rinsing in cool water can be very, very beneficial. Wiping down with a damp cloth after coming in from outside, even just doing that is huge. Washing bedding, getting rid of the dust mites, getting rid of the allergen load on the bedding. Because remember, these animals, if they're coming in with allergen on their coats and they lie in their bedding, the allergen can wipe off in the bedding and it's still there. They're being exposed. Keeping away from freshly mowed lawns. That's something, if you've got a dog or cat that has Atopy and you're out there mowing the lawn, keep them inside and close the windows for a couple of hours. So just little things like that. There's lots of other things like that, but those are some of the most common recommendations. All animals with Atopy probably need to be on essential fatty acid supplements. By themselves, they're not going to make much of a dent in the itch, but when they are incorporated into an Atopy program, that multimodal approach, they can make a significant difference. We're looking at, and you can read up on essential fatty acids and get completely confused. I know it happens to me every time I do. So I like to keep it simple. I'm a bottom line kind of person. So You cannot go wrong with omega-3 fatty acids. And what you're looking for in the active ingredients is EPA and DHA. Either one or both of those. Omega-3 fatty acids reduce skin inflammation, and they help rebuild the barrier defenses in the skin to reduce the allergen load. I put icosahderm on there just because that's one of my favorite products. Essential fatty acids are not prescription products, so I routinely, our hospital carries them, but especially for the larger dogs, to get the dose that you need, you might be given like 6 capsules a day, 8 capsules a day. This is one of the products that comes with a pump. So you can just put a pump on the food. It's like one pump for, I don't remember, like 30 pounds body weight. You read the label. But it's easier for owners to do, and acceptance from the animals is very good, and this is a very, very good quality product. Tons and tons of good quality products out there. This just happens to be one that I and my clients like a lot. Topical therapies. Colloidal oatmeal has been shown to have a temporary anti-itch and anti-inflammatory effect on the skin. It doesn't last very long, but it can absolutely help. Some active ingredients can help rebuild those barrier defenses. There's a whole line of products from Duoxo that do that. And then if we're dealing with skin infections, we may be picking a topical therapy that is either antibacterial or antifungal, depending on what kind of skin infection we have going on. And these can be shampoos, conditioners, mousses, spot-ons. For shampoos, if you're using a medicated shampoo, like a colloidal oatmeal or any kind of antibacterial or antifungal shampoo, anything like that, or anything that is to build, anything that is supposed to have a therapeutic effect, it will say on the label, or if it's a prescription product, your veterinarian will tell you, it needs X number of minutes of contact time. Most common is 10, but it could be 12, occasionally 15. You need that contact time. This is difficult when you have a 3-year-old golden retriever with lather all over him, right? Who wants to break free and run all over the house. But you've got to do it. I tell my owners, set the timer on your iPhone, set an oven timer so that you're not tempted to cheat. You need that contact time. And then, of course, you're rinsing extremely thoroughly. When it's a shampoo, you need to get all that soap off. I always tell people 3 rinses to every lather to get all the soap off. And obviously, you're not getting water or soap in the eyes or the ears. I'm actually a little worried about that dog's ears. But I'm sure the person is being very careful. For dogs with allergies, especially if they have food allergies or atopy, just getting water in the ears can be enough to set off an inflammation cascade that results in an ear infection. So, and many of these are retrievers that swim. So for those guys, many times we're sending home ear flush or some kind of ear cleaner product to have the owners irrigate the ears out after they go swimming, get the water out, and we're putting a product in there that actually restores that cool, dry environment that they need. Antihistamines. We used to use antihistamines a lot. I still do use them. I think overall their use is going down a little bit just because they've been kind of disappointing. If anyone here has really severe hay fever, and you are talking to anybody else with, I don't, but my boyfriend does, and so anytime he's in conversation with someone else with severe hay fever, eventually they get around to which antihistamines. Oh, that doesn't work for me at all. Oh, I think it's great. Same is true in animals. Any individual antihistamine only has about a 10 to 20% chance of working in any given patient. Some animals with atopy will not respond to any antihistamine. Sometimes we get lucky on the first try. Benadryl. I always start with Benadryl. It's cheap. It's over the counter. Unless there's a condition in the patient that tells me they can't have it, and there are some patients that should not have antihistamines. So I can't give a blanket recommendation or a blanket dose because that's something, even though those are over-the-counter drugs, if we're using them in animals, they are considered prescription by law. And so you really need veterinary advice for your individual animal. So I'm sorry I can't give general advice on what exactly to use or doses because I need to know the animal. But the other thing with antihistamines is that you need to use them consistently. Most of them you have to use them consistently for 2 weeks to see if they're going to work. And many times I'll ask people, hey, have you tried anything? They're like, yeah, I gave them Benadryl. Well, how long? Day and a half? Not going to work. So again, they're part by themselves. They usually are not enough. They can be incorporated into a full Atopy program and be really, really helpful. They're not going to put out wildfires, but they can help prevent wildfires from breaking out. A hypoallergenic diet. Now, this is something new, and this might be a little surprising, but we know that 5 to 10% of dogs, we don't know about cats with Atopy, but we know that 5 to 10% of dogs with Atopy also have food sensitivities. And the food sensitivities are enough to trigger an atopic flare. So we may be doing a hypoallergenic diet trial. We might be doing it as part of an initial workup to see what allergy they have. Or if we know they have Atopy, but we're not getting the control we need, we may put that animal on a hypoallergenic diet trial to see if we get better control of their Atopy symptoms. Because same as for flea allergy, if that animal does have a food allergy and we can control it, then managing the Atopy is going to be much easier. All right, we're going to get into some medications. Atopica has been around for about 10 years. The generic name is cyclosporin. It modulates the immune system. So it actually works directly on the immune system to help reduce inflammation. It is effective in approximately 70% of Atopy patients. Probably the biggest downside, other than the cost, is that we need to give it for 6 to 8 weeks to even know if it's going to work. So we're many times using some short-term management to get us through that initial period to see if the Atopica is going to work. If it does work, yay, and over the long term, in many patients, we can reduce the dose once they're managed. Apoquel has been out for a couple of years now. It's relatively new. I think it came out, I want to say 2014, maybe 2013, and almost immediately went on back order because the demand was so high. For a long time, only dermatologists could get a hold of it. I think that's not so much the issue anymore. I think it's widely available now. This blocks inflammatory mediators in the immune system. The substances, the chemicals that the immune system produces that cause inflammation, Apoquel stops that. It blocks that. It's effective in about 80 to 90% of atopic dogs. We don't know about cats. It's not labeled for use in cats, but some people are using it in cats. And so right now studies are ongoing to see if it has the same response in them. Nice thing about Apoquel is that we get a really quick response. So most animals will respond within 24 hours. So if I have an animal that needs short-term management to put out a wildfire, but for some reason they can't take a cortisone, like they have diabetes or they're taking arthritis medications and we can't use cortisone, we can use Apoquel safely. And we can use this for long-term management as well. The gold standard for treatment for Atopy is immunotherapy. Allergen-specific immunotherapy, this is where we get back to the skin testing and the blood testing, looking at what specific allergens that individual patient is allergic to, and then coming up with, I like to think of it as a witch's brew, of medication with those specific allergens for that patient. And the protocols, we start exposing the patient to the allergens from a very low dose and then progressively working up. So we're actually training the immune system not to overreact to these allergens anymore. We're actually desensitizing the immune system to these specific allergens. Immunotherapy is the only therapy that directly addresses the cause of the allergy by addressing it at the root in the immune system. It doesn't just block symptoms. It actually, I don't want to say the word fix, but it actually reduces the allergy itself. It is effective in approximately 70% of patients. And for animals where it is effective, we can then either reduce or, in some cases, stop using other medications. And because we're working with the animal's own immune system, and we're just working with allergens that are naturally present, there's no impact on the body. We're not worried about liver, we're not worried about kidney. This is a natural process. We're kind of messing with it a little bit to train that immune system, but we're not introducing anything artificial. Tricky thing is that response time could be 3 months to 1 year. It can take a year for it to start working. So sometimes we'll get response sooner than 3 months, but we may have to go out a year to know whether or not it's going to work. And obviously we'll have to do other management things in that year or however many months it takes. Some animals will get to the point where we can lengthen out the treatments, and they only need them every once in a while. Some animals we can stop treatment altogether at some point, usually after they've been on immunotherapy for a few years. Some animals are going to need it lifelong. We just can't predict who's who. We just have to see how they do. And it's administered, many are available either as drops under the tongue, so you just put it in the mouth, kind of aim for under the tongue, or by subcutaneous injection, which we teach owners how to do at home. So a little bit of a twist on this is something called region-specific immunotherapy, and that's under the trade name Respite. And that was pioneered by Dr. John Plant, who is a veterinary dermatologist here in Portland, actually. And Dr. Plant's thinking was that, he's like, I've been a dermatologist for a few decades now, and I do my skin testing, and these dogs are from the Pacific Northwest, and most of them are allergic to the things that grow in the Pacific Northwest. Shock, right? So he's like, what if, instead of having to test every individual animal, what if we put together kind of, I don't know if he would approve of my using the word cocktail, but what if we put together a set of allergens that is specific to the region? Not specific to the pet, but specific to the region. So he developed this, and it's been available for the past several years. Brand name again, Respite. And so far, the data are showing that he's getting comparable results to the allergen-specific immunotherapy, where we have to do the skin testing and the blood testing. So these animals do not have skin testing. They do not have blood testing. It's like, where do you live? Pacific Northwest. We're Region 1. And it's like, oh, I live in the Pacific. Okay, you're Region 1, and here's the immunotherapy. And he's getting comparable results for this. And again, this is available as subcutaneous injection or drops under the tongue. My German Shepherd is on this. And just as an aside, had a fabulous response to this. Actually responded within about 6 weeks, which is pretty good for immunotherapy. I mean, we were lucky. All the same rules apply. About 70% response is what we know so far, and it can take months to up to a year to see if it's going to work. This is brand new, hot off the presses, like this just got a conditional approval from the FDA like last month. So this is, you're hearing it here first. Canine atopic dermatitis immunotherapeutic. Yes, say that 5 times fast. All right, so what this is a brand new, this is a totally different approach. This is an antibody that neutralizes an inflammatory mediator produced by the immune system that tells the brain that there's an itch that needs to be scratched. It literally blocks the chemical signal to the brain. The chemical mediator, there's a few of them that do this, but the main one is something called interleukin 31. And this antibody is specific for interleukin 31, and it attaches to it and neutralizes it. So that signal just doesn't get to the brain. So I'm like, whoa, magic. Okay, that's awesome. It's a once-a-month injection. Right now, we just have pharmaceutical company data that were all their studies that they've done that they had to show to the FDA and that they show us. And they're telling us that they're getting, in their studies, before this was released, about an 80% response rate. That we have significant reduction in itch. And I think they're defining significant as at least 50% reduction in itch by day 3 after the injection. So I have not used this. I only know one person who has used it, and she posted on Facebook. It's like, oh my God, my dog's not itching. This is a miracle. So I have one testimonial. As it is, out, and being used, we'll get a lot more data. I guarantee dermatologists are going to get a hold of the stuff, and they're going to start doing their own studies. So we're going to get a lot more data in the next few years, but this is now available. Okay, we are galloping to the finish here. So last of the big three allergies we're going to talk about is food allergy. Now, many of my clients, by the time they get to my exam room, my clients are savvy, like you guys are savvy, and they're already thinking, many times they're already thinking allergy. And the first thing people often will think of is food. So sometimes people think of fleas first, but usually not. Most people don't think of atopy. A lot of my clients aren't aware that atopy is a thing in animals. Sometimes that's news to them because it's just not something that people generally know. But food, a lot of people think food. And so many times chronically itchy animals come in and the owner goes through the whole list of different foods they've tried because the friends told them to try this food or that food, or their mother-in-law tried a food, or all that kind of stuff, and they're not getting anywhere. And so they're like, I know it's not the food because I've tried different foods, and I'm like, but it could be the food, and we'll talk about why. So, what is it? It is an allergy to one or more of the proteins in the food. And so a food allergy is an allergy to proteins. Can animals be sensitized to fat or a starch or a food ingredient, a food additive? It's possible, but that's not an allergy. It doesn't involve the immune system. And it's really, really pretty rare. So when we talk food allergies, we're talking about an allergy to a protein in the food. It affects an estimated 1% of dogs and cats. Much less common. This is the other thing that takes people by surprise. Food allergy is not that common when we talk about the allergies. Much less common than atopy or flea allergy. And when we talk about, well, which proteins are most likely to cause allergies, what would you guys say? Good? Beef? Oh, you guys are good. Fish? Oh, you've been to this lecture before. Okay. Many people will say grains because of all the grain-free diets on the market. That's actually, you guys already know, that is not true. Most common allergens in dogs, you guys called it. So beef, dairy, there is a grain there, wheat, so wheat gluten, and chicken are the top 4 in dogs. This is a study of 278 food allergic dogs where the problem ingredient was definitively identified. And then you go down the list. A lot of people are like, corn. Yes, it's possible. Corn's way down here. Some dogs can even be allergic to rice, to the protein in rice. So that's possible, but the big ones, beef, dairy, wheat, and chicken. Cats, beef, fish, and dairy. I tell my clients all the time, do not feed your cats fish-flavored foods. It is not good for them for a number of reasons, but also because it is one of the most common allergens that will set things off. Fish, many of the species that are used in cat foods contain histamine, which is an inflammatory mediator. Histamine is why we take antihistamines. I've had cats with asthma that we could not control until we got them off of fish. I had one client that we were able to stop the asthma medications entirely once we got that cat off fish. So implicated in chronic inflammatory bowel disease, all kinds of different things. Don't feed fish. Cats, I kind of broke it out a little bit for skin symptoms only, skin and GI only, and GI only. Cats are more likely to show GI symptoms with food allergies than dogs are. Dogs can do it too, but cats are more likely to do it. But again, top 3 allergens in cats, beef, fish, and dairy. Typical age of onset. Now, like all the allergies, this can start at any age, but the classic presentations is under 6 months and over 6 years. Predisposition, not certain at this time. Some people feel that they are seeing this more in Labrador Retrievers, but then again, everybody has a Labrador Retriever. There's just a lot of Labrador Retrievers out there. So that we don't know. We do know that an estimated 20 to 30% of animals with food allergy also have either flea allergies or atopy or both. So again, multiple allergies are extremely common in animals. Typical locations, ears and rears. I didn't make that up. The dermatologists say that all the time. Food allergy is ears and rears. That's a light-colored carpet, so of course that's where the dog decides to scoot. Anal irritation is pretty common with food allergies. Not all food allergic dogs will have that, but it is. If we hear about anal irritation or recurring anal sac inflammation or anal sac infections, in my experience, and I learned this from a dermatologist, and it proved true when I started implementing this in practice, it's food allergy until proven otherwise. It can also get the face and the feet and underneath. So what does that sound like? Atopy. And again, like atopy, it can be any one of these locations, or all of them, or a few of them, any combination. And any of these symptoms can also occur in atopy. Even the anal itching can occur in atopy. It's not common, but it can happen. So based on clinical signs alone, unfortunately, don't tell us for sure what we've got going on. It can make us lean one way or the other. If I have a dog with anal itching or recurring anal sac infections, I am much more likely to push for a food trial before I jump into atopy treatment. But we don't know for sure. We need to still work it out. In cats, face, neck, and ears, yeah, this is very typical. We see this a lot. And this may happen more commonly in food allergy than in atopy. I feel like in my experience that if I see this, it is more likely to be food allergy than atopy, but I certainly have seen it a lot in both. And because they're cats, they can do the fur mowing, miliary dermatitis, or eosinophilic granuloma, because that's their bag of tricks, and they like their bag of tricks. So, history. The key is non-seasonal itching. Atopy is seasonal, at least when it starts. Food allergy is non-seasonal from the beginning on, which makes sense because there's chronic exposure, there's daily exposure to those allergens. So if we see non-seasonal itching, especially in a younger animal, that is highly suggestive of food allergy. Again, it's not diagnostic, but it's suggestive of it. In an older animal, middle-aged or older animal, it could be chronic atopy that's now gone year-round. It could be food allergy. So non-seasonal itching is a big clue. And I oftentimes, when I say, okay, well, I'm thinking about food allergy, very commonly I'll have an owner say, it can't be food allergy because he's been on the same food forever. More likely, actually. That is a classic history. This animal's been on the same food for a long period of time because it takes time for the immune system to become sensitized. So again, location, ears and rears, highly suggestive, but again, that can also occur in atopy, so not diagnostic by itself. Response to therapy. Many cases of food allergy are poorly responsive or non-responsive to cortisone. So if I get an animal in, I don't know what allergy is going on. I just know there's a wildfire all over this animal, and we're starting to figure out maybe what kind of allergy it is, but right now I got to put that fire out. So I talk to the owner, it could be this allergy, it could be that allergy, it could be this, it could be that. We're going to figure it out. But today, I'm going to send you home on the wildfire medications. And then I check back in with that owner. They come back for a recheck exam. I talk to them on the phone. And they're like, yeah, that prednisone you gave us, that's not doing anything. Oh, that's food allergy until proven otherwise. Now, can that happen with atopy? Yes, it can. And I have found that out the hard way. But, so it's not diagnostic, but it is a clue. Skin test, blood test, saliva, hair test? No, none. None of those are reliable in food allergy. Not even the skin test, not even the blood tests. You'll get results back, but they may not match up with what actually is happening in that pet. So dermatologists don't do these. We don't do these in practice. The only reliable diagnostic test for food allergy is a hypoallergenic diet trial. That's it. That is the only test that is reliable to diagnosis, and it has to be done right. We are very, very strict about this. So I talk to the owners a lot before. I don't just say, hey, here's a bag of food, go home. Because if a client is going to do a hypoallergenic diet trial, it has to be done right because we have to be able to trust the results. And these are difficult to do. Depending on the owner's circumstances and what they got going on at home, these can be hard to do. And I'm not going to put an owner through that if at the end of 3 months I'm like, yeah, I can't tell. I don't know. No idea. It has to be done right. So if there are circumstances that are going to prevent the owner from doing this correctly, then we may not do it at all, unless we can figure something out so we can do this right. So first of all, what is a hypoallergenic diet? Ideally, it is a diet that has one protein source and one carbohydrate source that the animal has never seen before. If they've never seen it before, they can't be allergic to it. That is as definitive as we ever get in medicine. If you've never seen it before, your immune system cannot react to it. So, because your immune system only reacts to stuff it's already seen. So, the reason that just switching foods doesn't work the vast majority of time is because commercial pet foods, most of them have the same ingredients. Now, this one may have beef listed in front of chicken. This one may have fish listed in front of the beef. But it takes just a tiny, tiny, tiny amount of allergen to keep the whole allergy going. And I don't care if it's 14th on the list in the ingredient list. If it's there, it's enough. Even if it's not on the ingredient list, I guarantee it was manufactured in a processing plant that had the offending allergen in it. And that's enough to keep the allergy going. So just changing brands usually does not work. Now, every once in a while, I'll have a client come in and say, oh, he used to itch all the time, and then my friend told me about such and such a brand, and I put him on. He's been great ever since. And I'm like, oh, lightning strike. It's like, wow, you have no idea how lucky you are. That can happen, but I've only seen that a few times. So just changing brands, not enough. So we want to use a food that the manufacturer guarantees, they literally guarantee there is no cross-contamination in the processing. So we don't have to worry about that. And so what we're talking about here is prescription diets. There are a lot of limited ingredient diets in the pet stores and some very, very good brands and very, very good foods, but they cannot guarantee this. They can't. And this is why the prescription diets cost so much, because they guarantee no cross-contamination. So at least for the diagnostic trial, we want to use a prescription diet. If the animal responds and we diagnose a food allergy, then heck yeah, go. You can either stay on the prescription diet or go try a limited ingredient diet and see if it works. Occasionally I have an owner say, I cannot do a prescription diet. Can I try a limited ingredient diet? And sure, try it, because it might work. It might work. But if it doesn't work, your animal could still have a food allergy. It doesn't rule it out. So there's basically two types of hypoallergenic diets. One is called novel protein, and we used this for years and years and years, and it used to be lamb. Actually, we used to tell people back in the day, back when I started, it was like, go home and start cooking up lamb, because these were not even available as prescription diets. And then a lot of the pet food manufacturers started putting lamb in their foods, and lamb and rice became a big deal, and we couldn't use lamb anymore because everybody had already had it. So a novel protein is a protein that the animal has never had before. So the most common ones that are available are venison, fish, duck, rabbit. You can sometimes find kangaroo. Dogs have never had these. Now here we are relying a lot on the owner's memory of what they have fed their dogs. So if the owner says he's been on this brand ever since he was a puppy or ever since he was a kitten and we've never fed anything else, that's easy. But sometimes it's like, well, I feed whatever's on sale, or I've tried a lot of the limited ingredient diets, so he's already had the salmon, he's already had the venison, he's already had the duck. We can't use any of those. So the carbohydrate is often potatoes, sweet potatoes, or peas. Some dermatologists actually prefer home cooking. They prefer the owner to home cook if they can, because then we have complete control over the ingredients. And if people want to do that, I just caution them, we need to get a diet that has been formulated by a board-certified veterinary nutritionist, which we can do fairly easily these days through balanceit.com or petdiets.com. Those are sites run by veterinary nutritionists, and I know that those diets are going to be hypoallergenic. The kind of diets you see floating around on the internet, on Mama Joe's dogfood.com, whatever, this is what I feed my 14 Bichon Frisés and 18 Dachshunds, those are not hypoallergenic. I've taken a look at, I've not yet found one that was truly hypoallergenic. So we need a hypoallergenic. So home cooking definitely is an option. if the owner has the time and wherewithal to do that. Hydrolyzed protein is a newer thing, well, newer, like past 10 years. And what this is chicken protein. It's usually chicken that has been broken down in the manufacturing process into tiny, tiny, tiny little pieces. So the immune system, you get all the benefits of the protein, all the nutritional benefits, but the immune system doesn't recognize it as chicken. Doesn't know what it is, but it apparently isn't chicken, so the animal can't be allergic to it. And we often will use this either when the diet history is unknown, like that 9-year-old that was adopted 8 months ago, and we have no idea what that dog's diet history was, or if the owner has already tried all the proteins that are available in the novel protein section. So how do we do this? We do short-term management as needed, like just for like all the other allergies. Excellent and consistent flea control, because we know 20 to 30% of our patients are probably flea allergic. And if they're getting bitten by fleas, they're not going to respond to the diet. We feed that hypoallergenic diet for 10 to 12 weeks. We know that only 1 animal in 4 will respond within a month. We have to go longer than that. We have to go 10 to 12 weeks. And during that 10 to 12 weeks, what I tell my clients is that the only thing that passes this animal's lips are the hypoallergenic diet and water. That is it. No treats of any kind unless it is the hypoallergenic diet. No supplements, no rawhides, no bully sticks, no pig ears, no cow hooves. Don't feed cow hooves anyway. They break teeth. Same with antlers. Flavored medications, you need to check with your vet. Some are actually okay. They'll actually be flavored with something hypoallergenic because those people were thinking ahead that manufactured those. But many times we have to stop the flavored medication and put the animal on plain tablets of whatever it is. So nothing, very strict. If we have an indoor-outdoor cat, it's like we got to make them indoors. We have to make them indoors. So if there is no response or only a partial response, then it's either not a food allergy, or if we get a partial response, then food allergy and something else, probably Atopy at that point, because we know the animal's on excellent and consistent flea control, so we know it's not a flea allergy. So what if the animal responds and all the symptoms resolve? All right. So the textbook way to finish out a food trial if the animal responds is to get them off the hypoallergenic diet and put them on the original food and see if they flare. They can flare as early as 15 minutes or as late as 2 weeks. And if they flare, bingo. We have confirmed you have a food allergy. Most of my clients do not want to go back to that. So the other option is we can just stick with a hypoallergenic diet. And how do we treat it? The test is the treatment. Go. More happy dance. Okay. More happy dance. Yay. Okay, so summary. How do we know when we're heading into a problem? Unrelenting itchiness, plus or minus bald spots, redness. When we need to start intervening. Short-term management used to put out the wildfires. It is short-term only. We need to start figuring out, even as we're doing our short-term management, we need to start trying to figure out what the plan is. How are we going to figure out if this is fleas, food, or Atopy, or a combination? And then which specific therapies are we going to use for that animal to keep these symptoms under control? And the whole time, we're using excellent and consistent flea control. All right. Thank you. I'm sorry this went long. I'm sorry, but I want to make sure you guys got the information.